Thank you so much, Dr. Kisule, for agreeing to this conversation. I think most important for me and for a lot of women right now who are mothers is the confidence that we are safe, our children are safe, and the pregnant women that they're going to be okay during this period. There's a lot of anxiety that's out there. What confidence can you give them for their emotional and psychological well-being in this time?
Okay, thank you very much, Josephine, and for hosting me. It's a very good question. Many women, many of our clients, our patients are calling us. Our phones are going off the hook because they're worried. Doctor, are you still there for us? Will you still be open? So I know psychologically it's daunting for all pregnant women at this time. People are feeling unlucky to be pregnant in this year. We understand you, we feel you. So far, we've actually tried to lobby that the government and the authorities give pregnant women and children a priority pass for transport. The other thing is that much as most hospitals have scaled down, many maternity units have actually kept running, even on fewer staff, so that we are there when you need us. We've tried to get KCCA to come on board, and KCCA has done a very good job so far, giving us ambulance service, a free ambulance service to patients. The other day, about maybe a week ago, maybe about 4 days ago, I had a patient who had a medical complication in pregnancy. She called me at about 2 a.m. and I gave her a number of a KCCA ambulance, and the KCCA ambulance actually brought her to Zambia Hospital, which was quite remarkable. She was very, very happy. So even in these times, pregnant women should be very confident and very calm. I know that the authorities have thought through about this for them, and we shall try our best to still deliver a service.
Okay. Do hospitals have hotlines at this particular point that women can then call? Because I think their mental health is as important right now as just about everything else.
Yeah, that's true. So mental health-wise, there have been a few numbers that have been circulating for people to actually, call and get help. But because of the nature of the practice of mental health, it's a bit difficult in this lockdown situation. But every hospital has made a number or two available to their clients to actually reach them on.
Okay. So your clients have numbers that they can call and somebody and seek psychological support and
yes, most of our clients, we've actually gotten in touch with them, and we've actually spoken to them, given them numbers for emergency care, and also a number for if they need to speak to anyone.
Okay, so I'm now thinking about the spouses of these women or the people they live with who have to have some way to help. I mean, you feel helpless if somebody is in that kind of position. What do these women need, and how can we support them from wherever we are?
Okay, so that's also another good question. Most women are supported by their partners, or if not partners, there's usually an auntie, a grandma, or somebody they actually stay with. So these people are actually fast responders, and if a woman needs help, they are the ones who will call the ambulance, or they are the ones who would have kept the bag somewhere to actually pack and go to hospital. So these people have actually played an important role in supporting pregnant women to come to hospital. So we also applaud them for that, and we encourage many more to actually step up if they can.
So what they should do is ensure they have all the numbers, the toll-free numbers for the KCCA cars. I know I spoke to Mr. Peter Kauju the other day from KCCA, and he was assuring me that the KCCA cars are ready and available to pick up people and take them. So partners and relatives around these women should ensure they have the numbers to call, RDC letters, and all of that, but also the packed bags.
Yeah, they have everything ready and in plan. So they get an RDC letter, have a car around. If not, they will have a number for an ambulance, so that they're actually prepared for any eventuality.
Okay. What is the most important thing for a pregnant woman right now, or for a woman who has just had a baby?
Okay. There are many important things, but for now is what we would really tell all our pregnant women is to remain calm, and to know that so far our country has not recorded very many cases. But that doesn't mean that we don't have some in the community that haven't it. So they need to continue to take precautions, okay, because they're carrying a baby, and they're in a vulnerable group. Much as we've seen that COVID-19 has not particularly affected pregnant women like other viral infections, we still need to take precautions and make sure that they wash their hands, still keep a safe social distance, and avoid overcrowded places, and you just naturally be home. Yeah, so for the babies, and the Ministry of Health released some guidelines encouraging mothers to keep their children going for things like immunization, because they're still important. And that if a woman needs to see a doctor, then they can actually get permission and come and see us, especially if they have any complications.
Okay, and we know it's important for pregnant women to exercise at this point in time.
Yes.
So how
yeah, that's true. So exercise is important, but when we say exercise in pregnancy, it's not really treadmill exercise, okay? So what we usually advise is that do not do anything new when you're pregnant, okay? So yes, if you've been an athlete doing a marathon, you can still do something, half of a marathon. But if you're not used to doing a marathon, do not pick it up when you're pregnant. We usually advise a 30 minutes walk around home is enough a day for every pregnant woman. So a 30-minute brisk walk is good enough for exercises. And there are people who, if they need to go upstairs or downstairs, that exercise is actually enough for them.
Okay, let's talk about the women who are pregnant and have other conditions. For example, somebody has asthma, somebody has allergies, and they need to keep coming to the hospital at every point. So maybe they have the letter from the RDC and are able to come, or maybe KCCA can bring them in the vans. But there's the general fear that hospitals right now are not safe because you're going to pick up something from there. What do you tell them?
So we need to reassure them and know that most hospitals, actually all hospitals, have scaled down. So the number of people coming to hospitals is reduced. So there's not a lot of overcrowding in this period. If you need medical care, and yes, there are many women who have pre-existing medical conditions, some of which may actually look like COVID, please come to the hospitals. It will be our role to screen you, deem you high risk or not high risk, but we shall not withhold any treatment just because you have any other existing condition. We shall give you the full treatment as it should be. Do not fear the hospitals, because that's where we will actually treat you from best.
Okay. Is there anything that they can do on their own at home before they come to the hospital?
Yes, so there are many things, and there are many things you can do at home before you come to hospital. One is that, of course, eat healthy, do exercise every day, listen to your baby move, and babies usually start kicking around 5 months. So we don't expect a 2-month-old person to come and say, I don't feel my baby kick after 2 months. So babies usually begin to kick around after 5 months. So they listen to the baby's movements, take your iron tablets. And if you don't have any iron tablets, walk to your nearest pharmacy, get your iron tablets, your folic acid, okay? Get your Fansida to prevent malaria, because yes, malaria is not going to go away because COVID has come. We still need you to keep healthy and do all the preventive things we do to prevent a pregnant woman from getting the communicable diseases that they have been getting and the infectious diseases. So the other things that they need to keep doing are, the usual things, deworming, doing breathing exercises at home, take a deep breath in, hold for 5 seconds, breathe out, okay? Talk to people, do not be alone, because now the chances of getting depression actually going to be higher, keep up with friends, speak to people, make a call, go out of the house. You don't have to be indoors all the time. Get into the compound, take a walk, and just keep to advises. A lot of bad information going on social media, and there are many bad things going on. People need to look at the brighter side of life.
That's true. That's true. How are you handling your patients?
So my patients, I have made an effort to make contact with each one of them by phone. to check on them and ask them how they're doing. Those who didn't have plans, we discussed a plan. Get your RDC's number in case you need to come in hospital. This is the place you will have to find us at. Make preparations. We have about 2 or 3 who are about to get to delivery, and we've made a plan that if this happens before, so we've discussed some danger signs they need to look out for. Okay. Things that are not dangerous, you can keep at home. We can discuss telephonically. But for those who feel like the baby has stopped kicking, my water has broken, I'm seeing bleeding, I'm running a fever, we've asked them that you need to come in to the hospital so that we actually check and see what is going on. We've also tried to reassure them and say, we are still here. There will be a team to manage you if you need help in the hospitals.
All right. Well, I know somebody who recently had a baby, and this was just at the beginning of this whole situation, and we're trying to stay away.
Okay.
Could you advise friends and relatives of people who just recently had a baby for the safety of everybody? I know it's easy to go to some people's homes.
Yeah, so no, that's very important, and that's a very good point. For now, we implore relatives, friends to give people space. Okay. For now, the times are not safe, and I know as a society we love visiting, we love baptisms, burials. A person has had a baby, we are all over them. For now, we are not allowing that. So it's actually one attendant, one patient. And when they go home, we also advise them and tell them, no neighbors coming to see the baby, keep your baby alone, keep your baby safe, keep breastfeeding the baby, and avoid social contact with people. They will be fine.
Okay. 2 more questions from me. What is the assurance or the confidence you're giving mothers that their babies will not get COVID-19? So if a mother presents with COVID-19 and you still have to go through, she goes into labor, the baby is born, what is the assurance that the baby won't get COVID-19?
So it's a good question. We cannot give assurances because much as the COVID situation is still evolving. A lot of new information is coming from the few mothers we've read about in China and in Italy, and some in the UK and France. The mothers who've had COVID have had negative samples for the babies so far. And they've done that by checking the baby's PCR, and they've also checked the placenta to make sure that there was no vertical transmission. For now, we think the highest risk is going to be around after the baby has been born and the mother is actually going to be breastfeeding. So for now, we would probably advise, and that will depend on on this situation. Now, this has happened mainly in countries that are well-to-do, where they can always give formula to mothers, free of charge. And that may not be the same here because we cannot say you're going to give formula to a baby. So that situation has to be assessed. Because breastfeeding per se will not pass COVID on, but the whole nursing activity, being with the baby.
Can they wear gloves? Can they
wear gloves, wear masks? It's going to be highly unlikely that the baby will not get infected from a mother. But for now, the current guideline is to isolate baby. For now, but I mean that's very controversial and has to be looked at, weighing pros and cons, because there's a likelihood of babies getting malnourished because mother cannot afford formula, and the chances of baby getting it are also small. So if a mother can mask up, be treated well breastfeeding a baby, it could be a plausible option. But there are no guarantees. We cannot say that we guarantee that they will not get. We'll just work within the means to try to mitigate the ways of which a person can get infected.
All right. Well, we saw. Well, you have. We saw a mother who had COVID-19 and she delivered a baby. And I think the thing that was running through my head, and we had quite a conversation in the newsroom about how did they deliver the baby without, you touched the mother who had COVID-19. So definitely you touched the baby as well. What are the extra measures that the hospitals are taking?
Okay, so that's a good one. So what happens is their hospitals have standard operating procedures in doing an operation for a patient with an infectious disease. Now, diseases vary. okay? Because when a woman is put under the knife, okay, the risks begin from the anesthesia. How they are going to anesthetize the patient, and in more times than not, if the patient is well and they're not very sick, they will probably use a spinal root, because giving a mother general anesthesia will more likely increase the risks of infection to the health providers. So they'll probably give an injection at the back to give a regional kind of anesthesia. But the doctors will have to be masked well so that they do not get the aerosols that are in the air to get infected. But touching the abdomen, they actually first have to clean the abdomen, and that the chances of getting infected are very small. We know that COVID is mainly around the respiratory area, so the nose and mouth. Touching the mother's tummy, if she hasn't touched it and you've actually cleaned, is actually safe for the baby. So it's very safe, because we actually have to first clean the baby. The mother, do a cesarean section, get the baby out, and the baby is still safe. And then get the baby to the baby doctors. Okay. Right. So in that kind of way, the risk to the baby is very minimal, even if the doctors have touched the baby, touched the inside of the mother, and also touched the baby.
All right. And some precautions are done for normal delivery as well.
Yes, that's true. The same precautions are taken for. So having COVID is not an indication for now to do a cesarean section. So a woman can actually give birth normally, and that's if she gets into labor. The question will come if she becomes very ill and they need to save the baby as well. That will become a challenge, and then maybe a cesarean section would be indicated in that kind of case. But for now, it's relatively safe. The modes of delivery, the issues are going to be coming post-delivery.
All right, Dr. Castro, thank you so much. But before I let you go, what is your message to all the pregnant women, all the mothers with young babies, newborns, and even older babies, toddlers? What is your message to them about this period that we are in? How do they keep safe? How do they keep hope alive? What do we do?
Okay, so to all the pregnant women out there, take heart. We, your doctors, are still on duty to help you go through this process. We are taking all necessary precautions to prevent you from getting infected. We ask you to be home if you don't have to come out of home. But if you have to come out of home, we're here to work on you. Please be safe. Avoid unwelcome visitors. Please keep your babies safe. Keep a social distance. Wash your hands, and have all these contact precautions done.
All right. Oh, and finally, before I forget, because we are being asked to stock up, yeah, and most of the food that we are stocking up is going to be the dry foods, and I don't see how that will help pregnant women, especially because they need vegetables, they need fruits, they need all of these things. What is your advice on their feeding?
So my advice is to eat whatever is available to you. Your baby inside is not going to die because you missed vegetables for, a week. But your baby you and your baby's health will be affected if you get COVID. So for now, we just get the locally available items if they are, and if you can stock up. If you can't, then you can do with those. It will still be safe for the baby. Missing a few vegetable days will not be bad and will not harm your baby.
All right. Thank you so much, Dr. Kisule.
All right. Thank you very much.
All right. Bye.